Xanax XR is a medication used to treat panic and anxiety symptoms associated with panic disorder. It belongs to a class of medications called benzodiazepines, which act on the brain and nerves to produce a calming effect. Xanax XR works by enhancing the effects of a certain natural chemical in the body called GABA. It is typically taken once daily, and the optimal timing for taking it should be discussed with a healthcare professional. The dosage will be determined by a doctor based on individual needs. Before starting Xanax XR, it's important to read the medication guide provided by your pharmacist. Take this medication by mouth as directed by your doctor, usually once daily in the morning. Avoid taking it with a high-fat meal, as this can increase the risk of side effects. Swallow the tablets whole and do not crush or chew them. The dosage is based on your medical condition, age, and response to treatment, and your doctor may gradually increase your dose until the drug starts working well. It's important to follow your doctor's instructions closely to reduce the risk of side effects. While Xanax XR helps many people, it can sometimes cause addiction, especially if you have a substance use disorder. It's important to take this medication exactly as prescribed to lower the risk of addiction. If you have been using Xanax XR for a long time and find that it is not working as well, talk to your doctor. And as always, be sure to tell your doctor if your condition lasts or gets worse. Some common side effects of Xanax XR include drowsiness, dizziness, increased saliva production, nausea, constipation, or changes in sex drive/ability. If any of these effects persist or worsen, notify your doctor or pharmacist. To reduce dizziness and lightheadedness, get up slowly when rising from a seated or lying position. Remember, this medication has been prescribed to you because your doctor has determined that the benefits outweigh the risks of potential side effects. Many people using this medication do not experience serious side effects. However, inform your doctor immediately if you experience any serious side effects such as mental/mood changes, trouble speaking, loss of coordination, trouble walking, memory problems, yellowing of the eyes/skin, seizures, or signs of a serious allergic reaction such as rash, itching/swelling, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects, so if you notice any other effects not listed here, be sure to contact your doctor or pharmacist. If you're in the US, you can report any side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Xanax XR, also known as alprazolam, is a medication used to treat anxiety and panic disorders. It works by calming the brain and nerves to provide relief from these conditions. It is important to take Xanax XR exactly as prescribed by your doctor to minimize the risk of abuse and addiction. Your doctor will determine the smallest effective dose for you and the shortest possible duration for taking the medication. It's important to avoid alcohol and other drugs that can cause drowsiness or breathing problems while taking Xanax XR, as this can lead to serious side effects, including death. If you experience slow/shallow breathing, severe drowsiness/dizziness, or difficulty waking up, seek medical help immediately. Additionally, suddenly stopping Xanax XR can lead to withdrawal symptoms, which can be serious and even fatal. Your doctor may need to gradually lower your dose to prevent withdrawal symptoms. If you experience withdrawal symptoms such as headaches, trouble sleeping, restlessness, confusion, depression, nausea, or seizures, be sure to notify your doctor or pharmacist right away. It's important to follow your doctor's instructions and not to suddenly stop taking Xanax XR to avoid these withdrawal symptoms. Before taking Xanax XR, it's important to inform your doctor about any allergies you have, especially to other benzodiazepines. This medication may also contain inactive ingredients that can cause allergic reactions, so be sure to discuss this with your pharmacist. It's essential to share your medical history with your doctor or pharmacist, especially if you have any lung or breathing problems, liver disease, kidney disease, or a personal or family history of substance use disorder. Xanax XR can make you feel dizzy or drowsy, and the use of alcohol or marijuana can intensify these effects. It's important to avoid driving or using machinery until you know how this medication affects you. It's also crucial to discuss the use of marijuana with your doctor. If you are planning to have surgery, be sure to inform your doctor or dentist about all the medications and herbal products you are using. Older adults may be more sensitive to the side effects of Xanax XR, so it's important to be cautious to avoid the risk of falling. If you are pregnant or planning to become pregnant, it's important to discuss this with your doctor, as Xanax XR may harm an unborn baby. It's also important to note that this medication can pass into breast milk and may have undesirable effects on a nursing infant. Therefore, breastfeeding is not recommended while using this drug, and it's crucial to consult your doctor before breastfeeding. It's important to be aware of potential drug interactions when taking Xanax XR. Certain products, such as GABA and sodium oxybate, may interact with this medication. Additionally, other medications, such as certain antidepressants, macrolide antibiotics, and drugs used to treat seizures, can affect the removal of alprazolam from your body, potentially impacting how Xanax XR works. It's crucial to inform your doctor and pharmacist about all the products you use, including prescription/non-prescription drugs and herbal products, to ensure the safe use of Xanax XR. Some products, like opioid pain or cough relievers, alcohol, and muscle relaxants, may increase the risk of serious side effects when taken with Xanax XR. You should also be cautious with products that cause drowsiness, such as certain antihistamines and medications for sleep or anxiety. If you smoke or have recently stopped smoking, it's important to let your doctor know, as cigarette smoking can decrease blood levels of Xanax XR. Always check the labels on all your medicines for ingredients that may cause drowsiness and consult your pharmacist about using those products safely. If someone has taken too much Xanax XR and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call 911 or your local poison control center at 1-800-222-1222. Canadian residents can call their provincial poison control center. Symptoms of an overdose may include extreme drowsiness, slowed reflexes, slowed breathing, and loss of consciousness. It's important not to share Xanax XR with others, as it is against the law. While taking this medication, it's also important to keep up with any lab or medical tests, such as liver function tests. Make sure to attend all scheduled medical and lab appointments, and consult your doctor for more details. If you forget to take a dose of Xanax XR, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed dose and take the next one at your regular time. Don't take an extra dose to make up for the missed one. It's important to store Xanax XR at room temperature, away from light and moisture. Make sure to keep it in a safe place and out of reach of children and pets. When it's expired or no longer needed, be sure to dispose of it properly. You can ask your pharmacist or local waste disposal company for guidance on how to do this. And remember, don't flush it down the toilet or pour it into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.